In tough times, this Sydney charity has provided free food and vaccines, and now rapid antigen tests.
It's great that this place is providing those tests.
You can come here.
Well, it takes a lot of pressure off your shoulders, and you know, the time that you save and the money that you save.
But the foundation says it's had no choice but to shoulder the cost.
Looks like you're all clear, Stephen.
So far, we've spent $15,000 to $20,000 on buying rapid tests because prices are going up and we're struggling to get them.
Reverend Bill Cruz says he's asked the New South Wales government for help.
All we're asking for is a puny 500 rapid tests a week. That's all, 500, and we can't get them.
The people around here are struggling like on a daily basis. Why should they have to pay? Like there's people out there that can't afford it. So they get pushed to the side and left behind? That's so unfair.
Both the state and federal governments are warning that chemists taking advantage of the high demand will be caught. This Sydney chemist was selling one single test in a Ziploc bag for $25.
Problem is that relying on the private market in this situation fails because of the fact that you don't have equity of access there because people can't afford these things.
The federal government is promising to provide aged care homes with rapid kits early this year, but so far organisations have been left to fend for themselves.
Uniting had secured rapid testing kits for ourselves, so because getting it from the government has been a challenge.
As long lines at testing clinics continue, the positivity rate has hit a high of 20%, with more than 18,000 new infections detected from around 90,000 tests. More than 1,000 COVID-19 patients are now being treated in hospital, with 83 in intensive care. 2 more people with the virus have died. It's become extremely hard to get your hands on one of these. Many tests are now being sold individually without their box so that retailers can distribute them more widely. Experts say this was always going to happen, but better planning could have prevented supply issues.
And so now we've got this problem of the blame game that's occurring at the moment. Now we just need to get them into play as fast as possible because they really are a critical aspect of actually trying to tell people whether they're infectious before they walk around.
And the government can't say they weren't made aware that this may happen.
Both the state and federal governments say free testing kits are coming soon, but the rollout is unclear.
It seems to me the most vulnerable at this stage have been left to languish.
For now, the community are on their own. Alison, Xiao, ABC News, Sydney.
Say hello to the man, say hello.